I am Dr. Jairam. In this episode, I am going to discuss the importance of emotional intelligence for the doctors. The concept of emotional intelligence became very popular when the book on the subject of emotional intelligence was released in 1995 by Dr. Daniel Goleman. After that, many research were conducted by various universities and all concluded the emotional intelligence helps 80% of success in the corporate, in the professional life, even the personal life also. But the IQ is helping only 20% of success. And therefore, the emotional intelligence become very hot topic in all the corporates all over the world. Now the question arises whether the emotional intelligence is useful only for the corporate people or only for the people who are working in companies. No, it is important for all the personnel, doctors, advocates, government employees, public servants, even the politicians, teachers, and everybody should learn emotional intelligence because in their professional success also the emotional intelligence plays a major role. And the very importantly, the doctors must learn emotional intelligence. What is emotional intelligence? The definition of emotional intelligence is the ability of a person to identify, understand, recognize his own emotions and feelings, behaviors, and thoughts, and the emotions and feelings of other people with whom the person is interacting. It is also the ability of a person to monitor, manage, and to regulate his emotions. Regulating the emotions is very important. That is what the emotional intelligence gives a clear thought. Now, when I talk about the doctors, they are meeting every day different type of customers, that is the patients. Some are coming for heart problem, kidney problem, or headache, or sometimes injuries, sometimes accident problems. Many people are coming like this every day. Different type of customers, different types of patients. The problem is that every patient is occupied by some family members. They are also having their own emotions. When these people are coming to the doctor, to the hospital, they have variety of emotions. They have worries, anxiety, fear. They don't know what is going to happen. If it is a heart pain, they think it is a cancer, it is a heart attack. Everybody is thinking like that. Particularly the old people are thinking like that. They are very much worried. The people who are coming with them, maybe wife or parents, they are very much concerned. Therefore, the emotions are different. The doctors have to understand their emotions. And also, they sometimes, by asking certain questions, irritating the doctors. The doctors should not get irritation. Doctors should not get tension. They should not get pressure. And they should understand the emotions of the people with whom they are talking. And therefore, they have to understand their emotions first. The emotions may be changing every minute. They have to understand different type of emotions, feelings, their behaviors and thinking while they are attending the patients. Therefore, the emotional intelligence is very important. I repeat the concept. Emotional intelligence is the capacity of a person to identify, understand, recognize, and regulate his own emotions, and also identify, understand, recognize the emotions and feelings of other people with whom they are communicating, with whom they are interacting at a particular moment. This is very important. For this purpose, a proper training is required for the doctors. The doctors are not learning emotional intelligence when they are studying in the college, when they are taking trainings in the hospitals. Therefore, many of the doctors are not having a deep knowledge in emotional intelligence. It is required. I have seen in other countries. Recently, I visited USA. I was there for 4 months. In many hospitals, they are teaching emotional intelligence for the doctors, for the nurses also. Even in the hospitals, big hospitals, they are arranging workshop. Therefore, emotional intelligence they should learn. If they learn emotional intelligence, what are the benefits? They will understand their emotions. They will understand the emotions of other people. They will understand their strengths and weaknesses. They will remove the weaknesses. They will enhance the strengths and use it in their profession. They will gain confidence in the process. When they are regulating or monitoring the emotions, the trustworthiness is developing. People will trust them. They will learn adaptability, how to adapt different situations when they are meeting different patients. And flexibility they will learn. Self-consciousness will be there. Therefore, emotional intelligence will helping them. The above all, there is a motivation. The motivation must be a self-motivation. Achievement motivation is required because the doctor's physiological needs are being satisfied. Food, shelter, and their social needs are satisfied. Safety and security are satisfied. Now they are looking for the satisfaction or needs of self-esteem or self-actualization. For that purpose, they have to understand the self-motivation, achievement orientation. They have to work for that. They must make commitment for that to achieve it. And they must be optimistic always. Even in the adverse situation, they must be optimistic. That is very important. They must learn the skill of regulating their emotions whenever they are meeting with the people. There may be very difficult situations. They may be working in the emergency ward, the ICU wards, and all the time their stress level may increase. The pressure may increase. It is really a challenging job. To mitigate all these things, challenges, unique challenges they are facing, they have to learn emotional intelligence and they have to learn how to regulate their emotions. That is very important. The another important is the social skill. First thing is social awareness. That is, empathy is very important. Empathy is what? A person put himself in others' place. A person put himself in others' shoes and feel it, understand it, how much it is pain. That is empathy. The doctor should feel it. He should every time he put himself in the patient's place and understand how much will be there. Then he will understand their emotions. He will understand his pains. He understands their feelings. Accordingly, he can help them. The helping is very important. Therefore, empathy is very important for the doctors. It is a service-oriented job. The medical, that is called the health service is very important. It is a service-oriented job. And therefore, they have to plan it. That is very important. Service-oriented. That is, they should remain in mind. They should develop others. They should understand the organizational politics. They will understand that. Above all, again, the communication is very important. Because when the patients are coming to the doctor, they are not in a position to speak properly. They may be speaking the wrong information. In one of the studies says in USA, nearly 5 lakhs people every year are getting the wrong treatment because of the miscommunication. Most of the miscommunication is taking place because of the emotional influence, out of fear, out of emotions of anxiety, nervousness, frustration, guiltiness. Sometimes they feel guilty because they feel they have done some wrong mistake, therefore they are suffering. Now, all these things lead to miscommunication and wrong treatment, and they suffer. Therefore, communication is very important. The doctors should understand proper communication when they talk with the patient. Whether it is a verbal communication, they should talk politely. They should talk the way the customer should, the person should understand it. But maybe a critical situation, they should talk very diplomatically. If there is a very serious situation, that is very important. They cannot talk aggressive communication. They should be very polite. And also the body language is very important. When the doctors are speaking with the patient, eye contact is very important. Then only the patient will think the doctor is concerned with their health. The doctor is empathetic. They will understand it. They will trust the people. Therefore, the eye contact is very important. Facial reaction is very important. That is very important in the communication. And conflict management is also very important for the doctors. There may be different types of mental conflict. In the hospital also, many people, when they are working, there may be internal conflicts. The doctor should solve it because the teamwork is very important. The team focus is important. The doctor who is going to perform a surgery must get the support of all the members who are in the team. Nurses are there. And there are many people. Operation theatre personnel may be there. There are like that. He should get the support of all the people, and their talent and the efficiency should be properly recognized and used. They should be motivated for the interest of the patient. That is very important. And collaboration and cooperation. There are various departments. Various medical reports may be coming. It may be X-ray, scanning report. Like that, many reports. Therefore, the doctor should keep a proper relations with all the department and discuss with them and understand it properly for the interest of the patient. Collaboration, cooperation is very important in the doctor's point of view. And that is why they need training. These things are this type of soft skill or emotional intelligence skill are not given to the doctors. In other countries they are giving. Even in British, I understand they are giving this training in big hospitals. Therefore, I request the concerned people to arrange proper training at the training college for the doctors, for the nurses. Even in the hospitals also, when they are arranging a conference for other subject, they should arrange some kind of workshop, some kind of talk by calling an expert, so that the doctors will understand the emotions with proper examples. That is what my request. In case if anybody call me, I can make myself available. I am free. I am a retired person. I have done a PhD in emotional intelligence. I used to give talks in various places. If any invitation is there, I am ready to come and help the people. Thank you very much.